Beyond Performance Sports. We're here with Milan Machaya today, and I wanted to take the opportunity today to talk about the fact that Milan's an extremely well-conditioned young 16-year-old that's been playing golf for about, what, a year and a half, 2 years?
2.5, yeah.
Yeah, all right. Normally when I'd see an American junior golfer at 17, going on 17, after playing for a number of years, they're going to come in with a very specific set of patterns in their body. They're already on the way to developing back problems in most cases, depending on who's been on their team and how they've been brought along. Milan came in and he was pristine. Nothing wrong with his body, a little bit of torsion. So one of the messages that I'd like to get across today is when you are trying to train a young athlete for development, I know we have our windows of trainability. We have our, active start, foundation, learning to train, training to train, training to compete, training to win. But there are variables that exist within those windows of opportunity. And we can't forget that if you miss an opportunity, like this young man didn't play golf as a young boy, but he did play a lot of other sports. And there's been controversy over, we don't use enough of our brain. Let me tell you that the most precise thing about how the brain works is that if you don't develop skills, then those synapses fall off. It's a myth that we're only using 10% of our brain. That's not the actual reality of it. What is the reality is that if you don't develop the skills, then those patterns never develop. So the plasticity that you keep hearing about can occur at 16, can occur at 65, at 75. And more importantly, with my patients, I'm really trying to stress to my older patients, learn how to play guitar, do things that are going to make your brain map differently as far as how those synapses are going to start to fire. What does happen at around 19 to 20 to 21 is a lot of those synapses are falling off because they're not getting activated. In this young man's case, he's played multiple sports growing up. That's a must. The statistics now show that you need variability in your development. There's supposed to be 2 windows of opportunity for speed. I can't buy that completely. I'm going to tell parents out there right now, if you miss one of those windows, don't be thinking that there's not going to be another one. There's still a lot of research to be done on that. So when we get to someone like Milan, my most critical thing is to try to keep him safe. Golf is stressful on the back. If we had a pitcher that threw 100 fastballs every day for a week, we'd be overloading him, right? And Tom House will tell you that. Obviously, when you're playing golf and practicing for golf, there's a lot of repetitions involved. By the nature of the sport, unidirectional speed, swinging at 100 miles per hour, this guy's already well over that. You know that creates a torsional pattern in the body. Everybody has a pattern, and their pattern's developed by genetics, it's developed by injuries, and it's developed by what you do, ADL, every day. In the case of a developing golfer, that rotational movement every day is going to set him up for potential injuries related to the overload on certain tissue. Now, what's the answer to that? The answer first is to recognize the pattern, and it's different for everybody. There are consistencies, but there's usually unique things that go along with each individual. And then you have to have him understand and feel. That whole concept of proprioception is so important. And Greg Rose from TPI explains this so well in his seminars, talking about like a wrist. If I take your wrist and I bend it down like this, Milan, and I say, close your eyes, I have you hit the heavy bag. You're going to say, no, I'm not going to hit the heavy bag with my wrist in that position. Because your GPS is active, you're very vulnerable there, right? Now, if we take this in this position for 3 or 4 days, he'd come back into my office, and guess what? That would be the new normal for him. His proprioceptive input has changed according to what becomes common for him, all right? So when we're dealing with a young golfer, one of the things we have to do is wake up his proprioception, make him aware that his hip might be starting to twist down, especially on the right side with a right-handed golfer. Just by giving him that awareness, he's got the cue. Then we set into effect recovery. And this is where I'm really having a problem right now with golf fitness. We've unleashed a huge force in the world of golf fitness over the last 20 years, and Tiger Woods was at the beginning of that. I like to go back to Gary Player. I'd rather follow what he was doing. I'd rather follow what Sam Snead was doing, because what we've done is we've created this this idea that the guy standing on the stage needs to be all buffed out and bulked and have mass and be a better athlete. Okay, that might be true. But how about the risk factor of being in the gym while you're doing that? This is money. Shoulder's money for a golfer. Elbow's money for a golfer. Wrist is money for a golfer. Low back is money for a golfer. You go and do a deadlift, and I can't tell you how many golfers I've seen their careers get ruined because of inappropriate training. So the other side of the coin is going to say, well, are we going to, just deny the fact that you have to train for golf? I'm not saying that. I'm saying that you have to be more judicious about how you train. Tom House has brought athletes along to their 40s, Tom Brady. When this happens, you see that there's magic in that. You can't take a quarterback and have him doing vertical presses with his shoulders. Can't do it. So our thrust of Beyond Performance is to try to get the message out that we have players at risk. We have in all sports. And we have to identify their imbalances. And again, symmetry is not the norm. Nobody is perfectly symmetrical. Some of the imbalances that develop in a golfer, for example, are productive for his motion, and you have to nurture that. But like Tom would say, you nurture the ability to develop your skill, stay safe, play long, but you've got to put energy back into the system. That's why you can't just practice for hours and hours and hours without recovery. So one of my big messages today is recovery is really important. It doesn't mean just sticking your butt in a bucket of ice. It means understanding what you've just done, how to recover from it and reverse the patterns. What I do is called corrective pattern training, involving more neurological issues, and that's the crux of it. So let's look at an example for Milan today. One of the things that's happened last week is he developed some of this innocuous left knee pain. I diagnosed it as a popliteal strain. That's not important. I treated it the way I treated it. It's much the same as you would get with a place kicker or anybody who has to move and plant and transfer their weight. And so by doing a typical manual therapy, we've relieved the issue. I've taped it with some kinesio tape. Now, what are one of the exercises I would give? Well, one of the things you've got to realize when you've got a joint issue, a myofascial issue around a joint, you don't necessarily want to create forces through the joint, shearing, torquing. But you do want to activate the muscles. And what I do with this case, and Milan, we'll just get you to demonstrate a split squat facing the other way. We're going to have the lead turn that way. We're going to have the involved leg forward. And what I say is critical here is we do what's called a short foot. You flare your toes up, your short foot. Now he's working on that critical foundation of little knuckle, big knuckle, heel, and it forms like a tripod. He's very stable in that. This transfers to his swing too, by the way, understanding the short foot. And what he does is he loads right into the knee, and depending on the athlete, we're going to be very aware of how much stride he has in this split squat, by the way, because this is very vulnerable. So what I want you to do is just do 5 reps straight up and down. And what we do is we cue, we make sure his lumbar spine is in neutral, because Milan has a tendency, go ahead, keep going. His lumbar spine tends to go into what we call an S posture, a little hyperlordotic. So we're always going to make him aware, find that lumbar neutral. And so what this does, it's like an anaerobic warm-up for him to get the quads, hamstring, calf, dorsiflexion, all going in one compound movement. And today we have him leaning into the table. And you have to make, especially when a player's coming off an injury, you have to make it as easy as possible, as stress-free as possible, get the anaerobic heat, the difference between a stretching routine and a warm-up routine. That's for another day. We'll go over that, and I think Tom might have gone through some of that. There's a big difference between stretching and warming up. So what we have there is part of our anaerobic warm-up for him coming off a little bit of a slight knee strain. And again, pay attention to the patterns. Understand you're developing this athlete to become, in his case, he's got aspirations to play at the highest level. If he hurts himself on the way there, that's not productive. So play hard, play safe, and understand some of these concepts.